Thomas DeLauer just dropped 15 ideas for beating insulin resistance. Here's the evidence-based way to use them without getting overwhelmed. First, the root. Chronic inflammation drives insulin resistance. Carbs look like the villain, but the real issue is inflamed, less responsive cells. Lower the inflammation and carb tolerance often improves. So here's the plan in tiers. Tier 1, do these first. They're free or cheap and have the strongest data. 1. Time-restricted eating. Even a 12 to 14-hour overnight fast can improve insulin sensitivity within a few days. Give your pancreas a break, lower the inflammatory load. 2. Resistance training. Insulin resistance often starts in muscle. Lifting 2 to 4 days per week, big compounds or bands at home, improves glucose uptake where it matters. 3. Sleep. A bad night can worsen insulin sensitivity 20 to 40% the next day. Target 7 to 9 hours. If you need help, magnesium glycinate 200 to 400 milligrams and glycine 3 grams before bed can improve sleep quality. Quick note, the products I mention, magnesium, glycine, carnosine, probiotics, allulose, resistance bands, and a red light panel, are linked in the description. Avoid magnesium if you have kidney disease, and talk to your clinician if you're on medications. 4. Second meal effect. What you eat in the morning changes how you handle lunch. Preload with protein and fiber, eggs and greens, Greek yogurt with chia, or a protein shake plus berries, and you'll blunt the glucose rise at the next meal. 5. Separate big fats and big carbs. When both hit hard together, substrates compete, often called the Randle cycle, and glucose control suffers. Keep plates simple. Higher fat with low-carb veggies, or higher carb with lean protein and minimal added fat. Tier 2, useful but optional. Carnosine. It helps limit formation of advanced glycation end products. Start with 1 gram per day, split doses, and titrate to 2 grams if tolerated. Probiotics and fermented foods. The microbiome influences glucose via short-chain fatty acids. A multi-strain probiotic plus daily fiber and fermented foods can help some people, especially after antibiotics. Allulose. This rare sugar doesn't spike glucose and may increase GLP-1 and reduce post-meal blood sugar. Start small to check GI tolerance. Tier 3, advanced or experimental. Red light therapy. Early data suggests photobiomodulation may support mitochondrial efficiency. Interesting, not essential. Methylene blue. Mechanistically plausible as an electron carrier, but it interacts with medications, especially SSRIs and MAO inhibitors, and is contraindicated in G6PD deficiency. Medical supervision only. 2 final points. 1. Whole foods do most of the work. Vegetables, lean proteins, seafood, legumes if tolerated, nuts, olive oil, fiber. 2. Metabolic flexibility matters. If you plan to include carbs later, practice with small, high-fiber sources like berries or sweet potato around training so your body stays good at using both fuels. Bottom line, start with Tier 1, fasting window, lifting, sleep, protein and fiber preload, and simpler plates. Layer Tier 2 if needed. Tier 3 is optional. This is educational, not medical advice. If you're on medication or pregnant, work with your clinician. If this helped, hit subscribe and catch the next video in your feed.